Welcome to the Humble Hoof podcast. My name is Alicia Harlov. This is a podcast for both horse owners and hoof care professionals, offering discussions into various philosophies on the health of the hoof and soundness of your horse. Please check us out on Facebook or at thehumbleHoof.com. A special thank you to our wonderful sponsor, Cavallo. For our Humble Hoof listeners, they are offering 15% off their Cavallo Trek hoof boots using the coupon code HRN at checkout. The Trek is the world's most popular and versatile hoof boot and Cavallo's toughest trail boot, while also doubling as an option for therapy or rehab. The front closure system makes it easily adaptable to various hoof shapes, and the TPU gaiter allows for maximum strength while minimizing weight for the comfort and ease of movement for your horse. These are recommended by vets and trainers and also loved as transport boots by barrel racers, show jumpers, dressage riders, and everyone in between. Again, for 15% off a pair of Treks, use the code HRN at checkout at cavallo-inc.com. I first heard of Dr. Erica Latcher from her podcast, Straight from the Horse Doctor's Mouth. She is an equine veterinarian down in Florida. She owns Spring Hill Equine Veterinary Clinic. And when I heard that she was also into evidence-based hoof care, I knew that I wanted to chat with her. I reached out to Dr. Latcher to see if she would talk to me about what veterinarians wish horse owners knew about their horse's hooves and things that horse owners can look for and ways they can improve their own horse's feet. Why don't we get started, and you can tell us a bit about your journey into the equine world and what led you to want to dive into veterinary medicine.
Well, when I was 5, playing in the living room with my Breyer horses, like every 5-year-old girl does, I found that I had a connection to horses, plastic and real. So begged my parents for riding lessons, got riding lessons, moved through the horse world as little girls do. And when I got into more, the high school realm of things, I found I was drawn to science, and I was drawn to the challenge of the questions that science asks us. Kept that up through college. Was like, equine veterinarian seems like a great plan. Let's see how that goes. Worked with some veterinarians, was around it a lot, showing horses pretty actively at that age, and just kept going along the road. Through vet school, I did all the equine classes. I love to pet dogs and cats, but I'm not a very good veterinarian for them. And I proved that repeatedly in vet school. So after vet school, I went to do an equine exclusive internship at a referral surgical and medical hospital in Texas. And that just, confirmed further for me that my love was being an equine veterinarian. And then since then, I came back to a very general practice. I say if it involves horses, I do it. Literally everything from making babies to managing geriatrics. We do all of it. Most of my work is sport horse medicine, but I do a little bit of all the rest of it on the side as well.
That's amazing. And I'm always amazed at how much you literally have to know to do your job, because it's such a broad range. Like you were saying, there's so much to cover that I'm sure that it's hopefully not overwhelming, but a lot to work through every day. So, thank you for doing all that.
One of the things that I enjoy about it, I have to say to any aspiring veterinarian out there, is that my day is never the same. So I have a schedule. When I get up in the morning, I look at it and say, this is what is on the schedule. Very rarely is that how the day ends up.
Yeah.
And, anything and everything can happen, and it keeps my brain very engaged. Versus I went to a specialist human medicine appointment the other day for an orthopedic concern, because I'm a veterinarian, so I have orthopedic concerns, right? And the doctor that I saw does knees, and that's all she does. Mm-hmm. So all day, every day, she's looking at the human knee. I'm like, wow, I don't know that I could do that. I can look at anything on any given day.
Right. It's so funny because as you're talking, I'm thinking about, I'm a full-time hoof care provider, and, all day I think about horse hooves, and if you had told me when I started this podcast in 2019, that I would still 6 years later just be talking about primarily horse hooves. I'd be like, really? There's still stuff to talk about? Like, that's amazing. But there's just so much to know, even within the equine foot, that like having to look at the entire horse body is just incredible. But that being said, I would love to chat a little bit about, as a vet, some of your perspectives about the equine hoof today and, kind of go from there. And obviously, I'm sure like there's so much else that's involved in the horse that affects soundness, not just feet. But I'd love to kind of dive into that.
I'm probably on your side where I'm like, it all starts with the foot. It is the most important.
Yeah. So on that note, like from a veterinarian's perspective, what are some common hoof issues that you see with your equine patients? Or, what should owners be looking for as warning signs of potential problems that could affect their soundness?
Well, one of the jokes that we have around my clinic is that they're going to get a cardboard cutout of me, and it's going to have one of those strings like the dolls have, like I think about Woody on Toy Story. And when you pull it, I'm going to say the toe is too long.
Yeah, I would say that too. Yes, absolutely.
I have to say one of the most common things I see is that the foot is in front of where it needs to be in relation to the limb. And that appears as the toe is too long. So that's what they're like, it's Dr. Latcher's motto, the toe is too long.
Yeah. And I will say again, like as a hoof care provider that stares at hooves all day, it's easy to look at feet from standing up at, eye level and not think that the feet look that long and then actually take a picture, because I take so many pictures of all the horses that I see at ground level, and the toe is so long. And I always tell the owners that I work with that if your horse's feet look short to you because you're used to seeing long toes, it's probably actually in a good spot. Obviously, that's not like there's so much more to it than that. And I know that there are people that actually recognize proper hooves. But is there any guideline that you sort of give owners to assess if their horses do have long toes?
Well, one of the things for me that I look at is I recommend that most of them get an app called Hoof Map. I don't know if you're familiar with that one.
I actually hosted Yogi Sharp for a clinic a few years ago.
Oh, well, I'm jealous now. But I find it's a really great way for them to take pictures of their horse's feet and start to get an understanding of where their horse's foot even is in space. But B, now I have numbers I can put to it where, let's be honest, you and I look at feet all day, every day. Every time I walk up to a horse, I look at their feet. You look at them from a totally different, like you really look at their feet. But I look at every horse's foot I walk up to. And, so we have in our head what we want it to look like. And what Yogi has done with Hoof Map is really take it and say, here are, some angles, here's some numbers, here's some lines you can draw. And I think that makes it much easier for owners and clients to really look at a foot and start to get an understanding. It is why with Ride IQ, we are coming out with the Horse Health Essentials program. And in there's an entire module on feet. And I applaud you for a podcast on feet, because I find it relatively difficult to say, just with my voice, paint you a picture of what a foot should look like. I think your example of if you think the foot looks way too short, then it's probably right is pretty darn accurate. But, you need that big full keel. You need the toe to really be farther back than you think it should be. When I pick up the foot, I want to see that the widest point of the foot, there's 50% in front of it and 50% behind it. And that's probably going to be a pretty good guideline. But again, in that Horse Health Essentials, we have a really great video section that we look at some feet and go through some of the angles that you'll see on good quality feet so that you have a guideline to look at and compare to when you look at your horse's feet. The next thing I say is, radiographs are really, really good. I think that every hoof care professional should come with x-ray vision. Unfortunately, that's not how Mother Nature sees it, so you guys don't have x-ray vision. But I'm sure that you see many feet that you look at and you say, I don't understand, why is that doing that? It shouldn't be. And x-rays will often bring that complete picture to say, okay, this is why this is happening on the outside. We got to look at the inside.
Yeah, absolutely. And another thing I tell owners is like, if you can give me anything, like baseline rads once a year are such a great gift. And not even just to like, as like a gotcha of, I want to
Yeah.
know if I need to fix something. It's not like, oh, you're doing a bad job. It's like, how can I improve? Or what is there something going on in this horse that we maybe don't recognize and it's not clinically pathological yet, but it's, starting on radiographs. That is something that I tell all horse owners that I would, I love seeing those radiographs at least once a year before any issues show up. So yeah, I totally agree there.
Christmas is coming. I mean, what farrier doesn't want foot radiographs for
Right.
Christmas?
And did you mention, so is Ride IQ an app? Sorry, not to like gloss over that, but I know you talked about it and I want to see what that was.
I'm going to go on a small rabbit hole here about Ride IQ. And Ride IQ is an amazing app for riding. I like to say it's like Peloton for horses. So you get on your horse. I use earbuds to do it with. So I have my phone in my pocket. I've got my earbuds in and I start a ride. And on in my ear is going to be a world-class trainer riding a horse doing the same thing I am. They're basically sitting on the horse and they're like, all right, we're going to do a 20-meter circle now. And then we're going to do that at the trot. And here's what we're going to do. They do it much better than me because they're world-class trainers. And you run through basically a ride with one of these trainers. And they have a 2-week free trial. When I first tried it, I was like, there is absolutely no way this is going to work. But I like to try new things, so let's give it a go. And I tried it, and I was blown away. It has brought, I'm an amateur rider who is obviously a veterinarian, so time is of the essence for me when I ride, and it has brought so much structure to my riding and has massively improved my fitness, my horse's fitness, our riding, our skill level, all of it. It is absolutely amazing.
So what's really interesting to me as you're talking about it is that, I run a hoof rehab facility. So I get horses in here that are usually out of work for a while. They've been lame. And as they become more sound, I'm either trying to help the owners get them back into work or start with like a hand walking plan and things like that. Do you know if there are any options of a tiered, like, okay, this horse has been out of work and they need to go back into work, like a tiered ride or like increasing fitness kind of thing?
There are several fitness programs on there. There is a ride in there that I did the other day. It was hot. It was Florida. I didn't want to work super hard, but I needed to get something done, right? So there's a ride in there that is 20 minutes of walk work.
Oh, that's awesome.
Right? And so I got on my horse and we went for a walk. And yes, I didn't have to physically work hard, but the two of us mentally got a whole lot done. And let's be honest, who doesn't need to work on the walk more? That's not what we're supposed to be talking about here, but let's be honest. We should all do more walk work.
I mean, really, like, so with hooves, I see walking, like purposeful walking, improving like the back half of the foot the most. And because I see, if horses are struggling with any kind of compensations, a lot of times as you go faster, those compensations might come out more. And then you have horses that might be shortening their stride. And then you don't end up actually developing the foot in the way that you should if they're not fully sound, whatever. I could talk about that forever. But all that to say, if I have horses that are coming back into work, the more walk work I do, the sounder I see that horse getting as their feet strengthen, in a sequential way. So that is like amazing.
Well, and the problem for us as riders is we get told, like, go walk for 20 minutes. And man, that is permission for me to be as bad as anyone else and go wander around aimlessly, not actually working, not doing any of the things. And in terms of even my sport horses, like you just discussed with the foot, we're bringing back tendon and ligament and some of these injuries, and we need them to go out and move. The feedback from the ground, from the movement, from the weight is what helps that tendon and ligament injury know, oh, this is how I'm supposed to heal. But we need them to not be trotting and cantering. So, we don't need the high level of work, but we do need work. And again, that wandering aimlessly, scrolling through Instagram walk is not terribly effective for those horses. And so, getting that actual movement, yeah, exactly. We're not going to stress that foot or that tendon injury or whatever it is, but we're going to get the blood flow through. Stress is probably, we are going to stress it, but we're going to stress it slightly so that it can do what we need it to do so that it can remodel appropriately.
Yeah, like more like physical therapy type stress, not like injury type stress. Yeah, yeah. Right. Absolutely.
Okay, so starting Black Friday, which is the day that this podcast will go up, Ride IQ, they are launching what's called Horse Health Essentials, and that is a program of 8 different sections that is all the basics you need to know for taking care of your horse. We have sections on vaccines, dentistry, hoof. Obviously, we have an extensive hoof portion. We talk about tack and equipment, not necessarily from like, oh, this is the best saddle, but as a veterinarian, what do I look at from tack and equipment to see that this is the best there is? What's the science behind tack and equipment out there right now? We have some fitness things. We have a whole section on deworming, because that is near and dear to my heart, because we all think we know what to do. We just go to Tractor Supply and buy one off the shelf, and that is wrong. And there is also a bit of a herd dynamic. So like, how do we take these horses in the situations where we try to keep them in, like, I get it. We're in show barns, we're on Long Island and there isn't space, but we want to have a horse. So how do we manage horses in all of the different ways that we manage them, from being turned out all the time, which is fantastic, but not feasible for all of us, to my horse lives in the middle of an urban area. How do I make their life as good as I can? So there's a whole bunch of different sections in there, and the link for that is rideiqelevate.com.
Perfect. All right. Thank you so much. Yeah, I'll definitely check that out too, even just for some of the horses here with getting them back into work. And I always get a little nervous because I don't want to do anything that's going to cause more issues as a rehab facility. I don't want to injure them. So I get like a little nervous. Yeah. Awesome. Yeah. And obviously we're talking about improving the hoof and improving the horse. So, as a vet, again, what do you wish that every owner would do to improve or maintain their horse's hooves or even their soundness? I guess that's along the same lines.
Well, there's 2 things, and one we've already touched on. Every horse would love to have lateral radiographs at the minimum of their front feet. If we can do DP, which is our fancy word for front to back, if we can do lateral and DP images of your horse's front and hind feet once a year, oh, your horse would say Merry Christmas. Your farrier would say Merry Christmas. Your vet would say Merry Christmas. Like, Merry Christmas to everyone, right? Like, I think it gets you such great information. We have really good research showing that negative angles in the front feet, that's existed for a long time, have detrimental effects moving up the leg. We now have even better research, thanks in part to Yogi, that hind feet angles are super important as well. Hind feet angles, as you know, as a hoof professional, require a lot more rechecking. Like, how is that angle actually looking in that foot? Is there something I need to look at elsewhere? We don't know chicken and egg, but there's probably a component of low back that goes with it. Who comes first? I don't know, but there's a lot of those 2 things that go together. And so having those foot films, again, of those back feet help us say, is there something we should be looking at? Are these feet going negative? Are we putting things in place to try to fix it? And are we having success with that? So I think, getting those radiographs is such a huge, huge thing. The other thing I would say this is going to be a little bit particular for Florida, but I'm sure that there are many other parts of the world where this happens, especially with mud season. But understanding the moisture cycle of your horse's feet in Florida in particular is really key to helping me keep a happy, healthy foot.
Yeah.
So out west, I was just out west, and I happened to be on a dude ranch while I was out there, and I was looking at horse feet, and I was like, wow, you can tell there is no humidity out here because these feet are hard as rocks.
Mm-hmm.
And that creates, that level of moisture creates one problem. In Florida, we have rainy season where it might rain an inch a day. We have wet season, and those feet are just sopping wet and falling apart. And if I don't have the ability to get the feet dry at some point in the day, I can't keep the foot together. Like, no matter what the farrier and I do, we are fighting a losing battle. So I think understanding moisture in your horse's foot and what you can do, talking with your farrier and your veterinarian about how to mitigate whatever is the moisture problem in your area.
Yeah, absolutely. And I see the same thing. I mean, I feel like if it's too wet, the feet just collapse and their integrity is not there anymore. And I swear that, 75% of what I do on my farm is improving the footing. I swear that's like all I do. And no matter how much I do the year before, I'm doing just as much the next year. It's just like we're doing it right now, but to prepare for winter, it's crazy. I just had my guy out today and showed him all the spots that we need to like scrape and resurface. It's like out of control, but I completely agree there. And I know obviously we talked about what the owners are doing with the moisture management, but kind of going back to, radiographs and working with your veterinarian, I've talked to a lot of farriers about collaborating with vets, but I actually haven't really talked much with veterinarians about collaborating between, farriers and owners. So how can owners work more effectively as a team with their farrier and their vet? And, what are some key pieces of information that each of these professionals really need from each other?
Well, the number one thing I would say is work really hard to schedule the appointment where the farrier and the veterinarian are there together.
Yeah.
It is so hard. And even my very best owners playing the telephone game of like, this is what the vet said, and this is what the farrier said. And we're real bad about slipping into lingo. And then the owners are like, well, the crustaceous hematoma did the thing, and I don't know what that means. And that's not even what I said. So, the most success I have is when I have an owner who says, here's my farrier's phone number, and I can work hard to get the farrier and I there together. We are very likely going to talk about that case ahead of time so that we have the base for where we're both coming from. And I think, having both parties willing to say, like, we need to go to potentially the next level. So, for example, in my area, we have an amazing equine podiatrist. We're very blessed by that. She is a certified journeyman farrier along with a veterinarian who really truly specializes in feet. And so when I'm having that conversation with an owner and saying, look, we have something really bad going on, we need to address it, and I need to pull in a specialist, that is not me taking anything away from your routine farrier. It's saying that we need to go to the next level. And so the ability for the farrier and I to have that conversation, separately, or to be sitting in front of the horse and say, this is the radiographs that I see from my standpoint, this is the stresses that I see, is so, so, so helpful. So the other day I was looking at a foot, and I'm not a farrier, and I'm like, I want more shoe here. Like, we keep having this problem with this splint because this horse has it's really straight on the medial side, and I just like it's sending too much weight basically up the medial side of the leg because of the way the horse's conformation is. And so the owner kept telling that to the farrier, and I understood that I was asking for a miracle, right? So but when the farrier and I were sitting there in front of the horse together, the farrier was able to say to me, I don't have the foot to do that. That is not something that is possible. The medial wall is too shelly. There were a lot of reasons why this was really difficult. And so the two of us were able to talk through what the options were for the farrier, what the options were from my side, what the horse was going to allow us to do. And, then we were able to say to the owner, okay, these are our very best options we have for this horse. Which way would you like to go? We've got A, B, and C. But having us there together, talking about it at the same time in front of the horse, was key to all of it being successful.
Yeah, and I will say, like on the hoof care side of things, I so appreciate, because I know veterinarians are so busy. You guys have things scheduled back to back on top of emergencies, and to have that veterinarian willing to make those discussion or have those discussions and talk through options is so valuable to me, and also makes me feel like I am part of a team and not just, doing the bidding of whatever's going on. When I first started, I might have gotten a little more defensive or been like, well, I want to try to fix it, or I'm going to do this, or I'm competent, I promise. But I think the longer that I do this as a hoof care provider, the more I realize like the horse is the main focus and their comfort is the priority and not like my ego or what I can and can't do. And so if somebody else is going to be able to offer a different option, I want them to. So yeah, I love that. And I think that's really hard for, in some areas, it's hard for people to sort of to do that, but it's definitely really valuable in a lot of cases I see.
Well, and like I said, we are blessed to have that ability here. It's helpful to be an hour north of Ocala because it has some horse care professionals that are in the area just because of the vast number of horses we have. But again, that collaboration, like you'll always get so much more if you can bring your farrier and your veterinarian together.
Yeah, absolutely. And those are honestly my favorite cases, more because I'm so excited to like geek out with a veterinarian and like look at radiographs and have those intelligent discussions at the horse, and instead of just, a lot of our job was working solo, really. And having that and feeling like you have a colleague and another person in that battle with you against whatever issue you're dealing with is really, really great.
The battle against the horse hoof that doesn't want to do what you want it to do.
Right. Yeah. And the other issue I come across, I'm sure that you see this too, and this is no knock on owners because I was there before I was a hoof care provider, is like looking for a quick fix of like you have this issue and the hoof is just not doing what you want and you just want to like throw something at it. Like, can I just give this supplement or like put this topical on and it's going to fix everything? So what are some, in your experience, what are some of the biggest myths that you see about quick fixes for hoof health, or ones that just, veterinarians in general wish owners wouldn't waste time on?
Hoof supplements. We have a podcast as well. It's called Straight from the Horse Doctor's Mouth, where I spend a lot of time talking about don't use supplements. Hoof care supplements, 99.9% of horses do not need them. And the 0.1% where I use them, I sometimes feel like it's me just wishing, and it's typically those horses that have something very bad. Like I think about the abscess that blows out the entire hoof, the bad laminitis, those cases where we want them to grow foot as fast as possible. And I'm like, well, it can't hurt. We might as well put it on. But for most of the horses out there, if you are feeding any commercial diet, and that includes ration balancers, which are the world's greatest invention, any of the commercial grains fed at appropriate quantities, they all have added biotin, copper, zinc, and methionine, which is what your horse needs to grow good foot. So spending money on a hoof supplement for most people, I would take that money and spend it on, personally, hoof radiographs. I mean, if I haven't said that already. But anyway, I would spend that money on hoof radiographs. And I feel the same way about a lot of the hoof dressings out there. Occasionally we have one in Florida that we use that has a high copper content, and that will help us, mitigate some of the vast amounts of just fungus and bugs we have here. But in general, I can't get a hoof dressing to fix the moisture issues I have because the horse is in that moisture for too much of the day for that hoof dressing to combat it. So looking at giving your farrier and your veterinarian the time and the space they need, and understanding that in many of these situations, we're looking at 6 months to a year to truly alter that foot to where we want it to be.
Yeah. And I say the same thing to my owners, like, don't waste money on like 90% of topical things, especially because I don't want to come to a foot that I have to work on and it has like a slathering of nasty oil all over it. But, and I truly think like, I'm sure I shouldn't name names on this, but whenever I hear the owners that I work with are feeding like 90% of the hoof supplements that are popular and have been around for a while, the actual ingredients are so much lower than even the NRC or what's required of the horse in a day. And they're spending so much money and it's really not even providing that much. And I mean, here I will say, like, we do focus a lot on diet, but we test all our hay because we have a bunch of metabolic horses. and I know exactly how much they're eating a day, and I know exactly how much of the minerals they're getting in their hay a day, and so I know how much I need to supplement or I need to add to that to make sure they're getting the daily requirements from the NRC. And so, that to me is a more like, if you're going to spend money on a supplement, do it because you know how much your horse needs and not just because it promises something on the label that it probably won't do. So I feel like I just wanted to throw that in there because everybody knows I harp on diet all the time. And I say that there, like you said, those, like the copper and zinc and methionine or limiting amino acids, I talk about those all the time, but I talk about it in the sense of like, we should actually know how much our horse is getting and make sure that they're meeting that requirement, but not just tossing a bunch of supplements at them that are not needed.
And my feeling as well is that when we have a foot that is properly supported, and whether that's because Mother Nature put the right hoof on the horse or we have done what we need to do to help that foot a little bit from a mechanic standpoint, when you do that, then the foot suddenly is like, oh, I have blood flow, and they grow like they're supposed to.
Yeah. Yeah, I agree. I mean, and I've talked to, I had Dr. Simon Curtis on the podcast a few years ago, and I met him when he came to Vermont a few years ago, and he did a whole study on like the growth rate of hooves. And, I was just like, are you sure that nothing really influences? I swear, I swear I've seen things. But yeah, it was really cool to talk to because he did a whole like thesis on it.
Yeah.
So yeah, but it's interesting that people are swearing that, if I just add this one thing, it's gonna change everything. So yeah, I totally get where you're coming from.
And like I said, I will sometimes add to, those horses where I'm like, oh, the foot is annihilated and we're just working on the process of growing it out. The big abscesses are the most common one I'm thinking of. And in the process, the owner and I have the conversation about, I think that this is very much wishful thinking, but if you would like to and it will make you feel better, it's not the hill I'm going to die on.
Right. So, yeah, I mean, along those lines, I think we talked about so many of the different topics that I deal with too with owners and just doing the like hoof rehab that I work in. But what questions should horse owners ask their veterinarians about their horse's hoof health and soundness? Like if you have an owner that's concerned, what kind of questions might get them the information they would need to improve their horse's situation?
The biggest thing I would say is having your veterinarian and saying, can we take lateral foot films? And now, can we look at those lateral foot films and look at some of the industry standards for, where is the center of rotation on this? There's some great things. What is the sole depth on my horse's foot? What are some of these measurements we can go through on the radiographs and look at together and say, okay, here is what we should have. Here is what my horse has. Now, can I give you my farrier's phone number and you guys can go get, beer or coffee, whatever your vice of choice is, and you guys can talk about my horse's radiographs. I think, that's the big thing. I think the other thing is sort of vice versa. When the veterinarian is saying to you as an owner, I have concerns about your horse's feet, I think making sure that you as an owner take that to heart and say, what can I do? Where can we go from here? I talk about feet all day, every day, because I think there is nothing that I can more readily influence that makes a bigger difference in a horse's life. I look at today, I saw a horse that potentially, luckily he didn't have a real bad ligament injury, but he had a mildly unhappy ligament. And his toe is so long. His heel is so far in front of where it should be. This horse has some chronic stifle things that go on with him. And I look at his back feet and his coronary band angles are pointed at his belly. And if, you're not sure what I'm talking about there, then those are great questions for your veterinarian. I heard on a podcast, they were talking about coronary band angles on hind feet. Can you show me what that is? That is us looking at literally the angle the coronary band makes with the ground. And from the hind feet, that angle should probably point at the knee on the front leg. And this horse's was pointing at his belly button. Yeah. So being there and having those conversations with your veterinarian and being open to both of you talking about what do you see on the foot? Do you think there's things that I could improve? And if your veterinarian, is saying these are the concerns I have about the feet, those are really serious because they affect your horse with every step they take. Heck, those hind feet angles, this horse doesn't have to take a step. Standing in his stall, he's got pressure on those tendons and ligaments running down all four of those legs because the toe is out in front of him.
Yeah, absolutely. Yeah, and when you were talking about the radiographs, when you were saying what questions can owners ask their veterinarian about them, one of them I thought was owners should ask, "Can you send these to my farrier?"
I should have thought of that. For us, that is an SOP. Like if we take foot films, they go to farriers no matter what. So I forget that is a good question because for us, that happens anytime we take a foot film. We ask who's your farrier and we'll get these to them.
Which is amazing. And I work with a variety of different vets and a lot of them are so good and they just send them right away. But some of them, I feel like I have to remind the office multiple times. And sometimes I'm like at the appointment being like, hey, can you send those right now? Because I want to look at them. So yeah, I'm sure that there is so many reasons why, they don't get sent right away. I'm not trying to throw anybody under the buses, but yeah, if owners can jump on that wagon to sort of remind and nudge them to be sent over, that's always helpful.
And it's not perfect, but even taking a cell phone picture of the screen, like as we're taking them and sending those to your farrier, like it's at least a starting point. And then you and your farrier both remember that radiographs exist and we need to make sure that the veterinarian sends them.
Yeah, right. And I know that we talked about so many different topics and we sort of jumped around, but is there any sort of like last advice that you want to offer to owners or hoof care providers or even other veterinarians when it comes to these, hoof lameness cases?
I think that knowing horse feet it's obviously a lifetime educational system. And horses, just when I think I know it all, they're like, I'm going to do this different thing that makes no sense. So, I think being committed to learning what your horse's feet are telling you and asking any professional in front of you, what do you see on these feet? Looking at, I think Yogi Sharp makes some of his stuff very, very accessible, listening to podcasts like The Humble Hoof. All of those are great ways. But the more you can learn and understand about your horse's feet, the more you'll understand why it is truly no hoof, no horse.
Absolutely. Yep. And I've, basically built my life on that. So I agree. Well, yeah, I think that's the main bulk of what I want to chat about. And I really appreciate you being willing to take the time to talk to me. And yeah, this has been super fun. And I look forward to looking more on that app and checking out your podcast more too.
All right. Sounds great. Thank you so much.
Oh, yeah. Thank you. This was awesome.
All right. Have a great rest of your day.
Thanks. You too.
Bye.
Bye. I always say that I'm slightly more hoof obsessed than the average person, and chances are, if you're listening to a hoof care podcast, you are too. So we should probably be friends. Feel free to find me on Facebook or email me at thehumblehoof@gmail.com.